Hello, my name is Heidi Taylor and I'm a registered dietitian for the Bacon County Hospital and Health System. Today I'm going to be talking with you about nutrition and the COPD patient. COPD stands for chronic obstructive pulmonary disease. I'll be using this term frequently, but it is an umbrella term that is used to describe progressive lung diseases. Now, a healthy diet is important for everyone, but it is critical for the COPD patient. The COPD patients need more energy to do the work of breathing. They actually burn more calories than your average person to do the work of breathing. You're using accessory muscles, and those are burning additional calories. So one of the big things with the COPD patient is that we want to avoid any unplanned weight loss. When you have unplanned weight loss, you have muscle deterioration. When you have muscle deterioration, your muscles are not able to as effectively do that work of breathing. So then that is a cycle that we see if they lose weight, their shortness of breath increases. When their shortness of breath increases, they want to eat less. So we want to prevent that in the beginning with having a good healthy diet. So next I'm going to talk to you about what is a healthy diet. Now this information I would give to anyone. This isn't specific for COPD. This is just a basic, what makes up a good basic diet. We want to really focus on protein. We want to get a good source of protein at every meal that we eat. Good sources of protein include things like your poultry, chicken, turkey, eggs, fish, your beans. So these are all lean sources of protein. Next, we want to talk about the fruits and vegetables, and we would want to see those be the main source of your calories on your plate. We would like to see fruits and vegetables taking up the majority of your plate. And as far as carbohydrates go, people have a lot of questions about that. We do want to see people doing more complex carbs and more things with whole grains. You're getting in more vitamins and minerals in your whole grains. You're getting in more fiber, and these are things that we all need. The next thing I want to talk about is that how many calories you need in a day is based on the individual. To get that number, you would need to speak with a dietitian. We're going to be looking at your age, your height, your weight, the severity of your lung disease to come up with an individualized number for you. So on average, the COPD patient needs an additional 400 to 700 calories in a day. So that's where nutrition really comes in as being vital, is because we need those extra calories to prevent weight loss. So now we're going to talk about how do we get those extra calories in through our diet. So these are just some tips. So mix in a teaspoon of butter, margarine, olive oil into your hot foods. Use a lot of peanut butter. Use that for your snacks, even if you're eating something that can incorporate in your mealtime. Use honey for sweetening. Do homemade milkshakes or smoothies where you can add in protein powders or you can add in egg substitutes. Keep high calorie snacks around. These are things like your nuts, your raw almonds, your walnuts, olives, your dried fruit. All these things can pack a big punch when it comes to calories, and they're things you don't have to cook. They're easy to get up and grab. Some other ideas are adding things like olive oil or flaxseed to cottage cheese with fruit, keeping some string cheese around. These are all ways to get in those extra calories. Now, when it comes to meal times, we do want to be sure that you're eating foods that are easy to consume, because the COPD patient is already having more trouble breathing. They wear out faster. We want to make mealtime enjoyable, and we want to make it as easy as possible to get those calories in. So a few tips here are to make sure that you cook your vegetables until they're soft. Grind up any meats. Eat soft foods like pastas, mashed potatoes, thick or cream soups. These things are easy to get down. Once again, the fruit smoothies, the milkshakes, these are all things that are going to be easier for you to consume. Now we do know that the COPD patient struggles with shortness of breath. So these next things I'm going to tell you are just a few tips to help with reducing that at mealtime. Try to rest at least 30 minutes before mealtime so that you're ready to eat. We don't ever want to come to the table already being short of breath. That'll make consuming your meal much more difficult. Always sit upright, lean forward. That'll help with the bloating. That'll help with the pressure. We never want to eat when we're lying back. Like we mentioned, eating foods that are easy to chew. If you're on continuous oxygen and you do struggle a lot at meal times with eating and breathing, you may want to mention that to your doctor. They may actually want you to increase your rate during mealtime. Because we know the COPD patient does wear out during meals easily, this is probably my biggest tip that I think is most helpful, is try to eat 6 small meals throughout the day rather than the traditional 3 large meals. You don't wear out as easy. You're more likely to get in the calories that you need if you do 6 small meals versus if you try to do just the 3. If you're going to have a larger meal, have it earlier in the day. Rest before eating. Like I said, don't come to the table out of breath if you can help it. Let's see here. We mentioned carbohydrates earlier, but another reason why you want to always have the complex carbs and not the simple carbs is the simple carbs include things like sweets, cookies, pies, cakes. Those things actually can make you hold on to too much carbon dioxide. So we want to try to avoid those, as much as possible. Now, COPD patients can deal with bloating. So the next set is some tips that I have to help reduce the bloating feeling. Try not to rush your meals. In general, we say try to spend 20 minutes eating, and that'll help you not rush through. When you rush through, you're actually consuming a lot of air as you eat, and that's going to increase that bloating feeling. So take your time. Like we mentioned, eat several small meals throughout the day versus the traditional 3 large. And then another point is with your fluids. Try to consume your fluids an hour before you eat or an hour after you eat, rather during your meal if possible. We don't want you to get full off fluids. We want you to get those good calories in so that you're meeting your calorie needs for the day and we're preventing the weight loss. So fluids before, after, not during. If you have trouble with gas and bloating, try to avoid foods that increase that. So things like your cabbage, broccoli, carbonated beverages are a big deal. Try to avoid carbonated beverages at mealtime, especially because those are going to create more gas. If lactose bothers you, you will need to reduce your dairy. You'll need to reduce your milk, your ice cream, your yogurts, things like that. Let's see. Lastly, I want to go back to the fluids. Like I said, try to avoid having it right before or right after your meal, but having enough fluids throughout the day is very important. We want you to get at least 8 to 12 cups of caffeine-free fluids in a day. So we would prefer that be water. I know sometimes that's not going to always be the case, but at least 8 to 12 of caffeine-free. It is important to thin out and clear out lung secretions, and we know that oxygen therapy is also very drying to your airway, so it's important to get plenty of fluids in. Next point is to watch your sodium. Try to watch how much salt you take in. Choose foods that are lower in salt. I always say that salt and water are best friends. Wherever salt goes, water follows. So it'll increase your bloating, it'll increase your shortness of breath, and it can also increase your blood pressure. So try your best to reduce sodium in your diet. That is pretty much the majority of the tips and tricks that I had today to try to help the COPD patient get in the calories they need, enjoy their mealtime. So talk with your dietitian if you'd like more details, if you'd like a personalized meal plan.